Hannah. I'm going to be your nurse today. Jennifer, it looks like your doctor has an order for a peripheral IV. So what that means is there's going to be a small flexible tube in your arm that's going to provide some, in this case, primary fluids for you. It's just going to be some normal saline because the doctor said you're looking a little dehydrated today. She says okay. All right, so before I start, I'm going to verify with my MAR that I do have the right person. Can you give me your first and last name and date of birth, please? She says it is Jennifer Doe, 11/5/1975, which was on her armband. Okay, Jennifer, give me a moment. I'm going to go wash my hands and get my supplies. Okay, so I'm going to wash my hands. I have a transparent dressing. I have a extension set. I have a 20 gauge catheter IV. I have a 10 ml normal solution, normal saline solution flush. I have a pen to write my initials and my date on my transparent dressing. I have a few pieces of tape to tape down my extension set once I have the IV in, extra tape if I need it, and a tourniquet, as well as a clean pad to put underneath Jennifer's arm, just to make sure that we don't mess up her bed and her linens. Okay, so Jennifer, I'm going to go ahead and put my clean pad underneath your arm. We don't want to mess up your sheets here. Now, looking at Jennifer's arm, I'm going to be looking for a vein that is nice and straight and is distal to any joints, so that if she bends her arm, she won't occlude the IV. Jennifer, what are you, right or left-handed? She says that she is right-handed, so I've chosen to do it in the left arm. Jennifer, are there any reasons why I couldn't do it in your left arm? She says no. Now, I would avoid an arm if it had a amputation, a deformity, if there was a mastectomy on that side, as well as if the skin was very vulnerable, as in a burn. Okay, so I am going to go ahead and I have palpated a nice vein. I can see it here, but I'm still going to use my tourniquet to occlude the vein as much as I can. Okay, I'm going to have my tourniquet about 3 to 4 inches above where I'm going to be going in with the IV. Starting at the bottom, I can always work my way up. I'm going to go ahead and palpate to make sure that I can feel the distal pulse, which I can. I'm going to release my tourniquet. Oh, the wrong one. Release my tourniquet while I get my extension set flushed. Okay, I'm going to wash my hands. Actually, I'm not going to put my gloves on quite yet. Okay, I'm going to loosen the cap. It is loosened. I'm going to, my lock would have been open, in the open position. I'm going to flush it to make sure there are no air bubbles in there. As soon as I'm done flushing, I'm going to close the clamp. Lay that back down there. I'm going to go ahead and open my tegaderm so that it's ready for me. And I'm going to write the date as well as my initial on it. Okay, so I have that. I have my tape. All right, there's my hands. I'm going to go ahead and put some gloves on. Okay, Jennifer, this is going to feel, actually I'm going to pull this out a little more to make it a little more even. Jennifer, this is going to feel quite tight on your arm, but you should not start to lose feeling in your fingers or feeling tingling. Once again, I am going to check that I can feel the distal pulse, which I can. All right, so I have my 20 gauge IV needle here. I'm going to open my new alcohol swab, and I'm going to swab in a circular motion where I'm going to be placing the IV in a outward motion. Okay, now that I've cleaned the site, I have my IV. I'm going to remove the cap. My bevel is up. I'm going to twist the catheter part so that it is not tight on there. I'm going to go ahead and pull down on the vein. Okay, on the count of 3, Jennifer, we're going to be a 1, 2, and a poke. 1, 2, poke. Okay, once I see my flash, I'm going to lower my angle. I'm going to advance a little further into the vessel, and then I am going to advance the catheter. Once I have the catheter up to the skin, I'm going to bring over my extension kit. I'm going to remove the cap. I'm going to pull out my needle and attach my flush. I'm going to go ahead and flush my line to make sure that it's patent, which it is. I have 10 mils in this flush. Once I have finished flushing the line, I am going to close off my line. Okay, I'm going to use a piece of tape to tape it down. Then I have my clear dressing. Oops. And I am only touching the outer aspect of the dressing with my dirty gloves. I'm going to go ahead and cover the line, pulling away the paper portion. You can go ahead and remove the label, placing it to the side as I do so. I can disconnect my flush and tape it further to prevent it from moving around and falling, so that the patient doesn't lay on it and pull it out. Okay, Jennifer, I'm going to go ahead and get cleaned up and then go document. So I'm going to pull this away. Okay, I'm going to get rid of that, rid of my supplies, put my needle in the sharps container, and then I'm going to document the gauge of the catheter. I'm going to document the gauge of the catheter. I'm going to document the time and date that I inserted it, the site that I inserted it at, my patient's tolerance to it, and how much I flushed into the catheter. I think that's it. I've cleaned up my materials. I'm going to wash my hands, and that'll be it.